Healthcare facilities have come a long way with the areas of sanitation in their facilities. Life expectancy increased a drastic amount at the start of the 1900s. The expected age of death at the beginning of the 1900s is said to be around 30 years old across all regions in the world. With the rapid change and evolution within the healthcare facility, I found the health care sanitation topic to be interesting. Healthcare sanitation has become a vital aspect of the lives of many human beings. It has saved many lives by preventing infections and bacterial growth on things as simple as the materials used when cleaning an open wound. It shouldn't be a huge surprise to the public that life expectancy may arise when an increase of cleanliness came to be. Cleanliness within a medical study produces an aspect of longevity when being seen in a healthcare facility. Sterilizing an environment lessens the chance of severe health conditions when dealing with open wounds. In 1872, the American Public Health Association was founded by Dr. Stephen Smith, who helped spread valuable information on yellow fever, water and sewage examinations, and etc. With Smith's organization spreading information regarding health regulations and safety, the APHA released a public hygiene journal in 1906. With the spread of influenza in 1918, the American Public Health Association tried to spread knowledge amongst the public of health factors and sanitations that can be taken place. A clean and sterile environment also prevents the spread of other airborne diseases and pathogens. Though the timeline for sterilization is relatively new, it has progressed immensely and rapidly. According to the Kaiser Family Foundation, it wasn't until 1939 that the Department of Health and Human Services was created. Having the Federal Security Agency bring together federal agencies that held the same concern for health. As for the concern of human well-being and cleanliness, the evolution continued rising. In 1946, a program called the Malaria Control in War Areas became what we know today as the Communicable Disease Center, or the CDC. Though the CDC was born in 1946, it wasn't until a year later the spread of the division was created to focus on protecting and improving human health. In 1946, the CDC was finally transformed and transferred from a state relations division and became established as a field station. This led to the investigation and studies of a plethora of diseases. Leading investigation of said issues causes for the creation and usage of vaccines. The CDC began to gain world recognition as the organization continued to release information and preventatives for sickness. In 1956, the influenza pandemic struck the world again, starting in Hong Kong, and the CDC quickly set up a flu surveillance unit. This helps conclude the severity of the sickness and again releases information on cleanliness and the importance of slowing down the rate at which it spreads by washing your hands and covering your mouth when sneezing or coughing. As the time progressed, the flu killed 550,000 people in the US and 20 million worldwide. People with the flu and other contagious illnesses are cared for in isolation hospitals. They isolated patients with these illnesses and upheld high standards for cleanliness, which likely prevented infections and saved many lives. Life expectancy has increased rapidly since the Age of Enlightenment, and many countries that were suffering from bad health are catching up rapidly. According to ourworldindata.org, the global average life expectancy has doubled since the 1900s and is now above 70 years old. Life expectancy is on the lower spectrum in the countries with the worst health and cleanliness. A survey taken in 2021 concluded that the shortest life expectancy in the world is 52 years of age in the region of Chad. Globally, life expectancy has increased from less than 30 years to over 72 years old. After 2 centuries of progress, we can expect to live much more than twice as long as our ancestors. Over the last 200 years, all countries in the world achieved impressive progression in health and cleanliness that led to life expectancy increases. This is a significant indicator that health care protocols and cleanliness are implemented to help decrease the number of sickness and diseases spread. Taking the correct precautions has raised life expectancy and has reduced the amount of illnesses that can be spread to others from the lack of sanitation.